I guess the reason for wanting to work globally was recognising the need for the gospel and also the physical health needs around the world. So global mission was something that I was interested in from my first day as a medical student. After I completed foundation programme, I headed off to Bangladesh with Medair, which is a Christian humanitarian organisation working with Rohingya refugees as a nutrition manager. Then went to a Christian mission hospital in northern Bangladesh and volunteered in the paediatric department before starting a Masters in Public Health based in Bangladesh. But I ended up unexpectedly returning to the UK due to COVID. When you're abroad, it's a great opportunity to be practicing medicine alongside people who have a very different background, to be able to share your skills and learn from them at the same time. It's a real opportunity to be part of what God's doing around the world. CMF has been a massive part of my life since I've been a medical student. There's so many resources around that you can learn from, which I love, but there's also people who've got similar passions and interests, and the programmes that are run by CMF are really relevant. I've attended most of the CMF global seminars in every conference I've been to and learnt so much through those. But I found particularly the global track really helpful in equipping me. As a young medic, I was full of excitement for what I could do, but there was loads of fears mixed in too. And CMF has been like a springboard to explore new ideas, but also a safety net to grapple with those fears that I've had and process them. I think being out of your depth is one of the things that you'll definitely experience if you work overseas. And it's great to know that CMF have people who have been there before, who understand, and being able to offload to them or speak to them and get them to pray or understand kind of how they've managed with similar situations is something that CMF is unique in being able to offer. CMF know people throughout the world. There are opportunities throughout the world to get stuck in. They know the needs and they can connect you to those opportunities. Global mission isn't just about doing things abroad, but also locally. So I've engaged in the refugee and asylum seeker health course, which helped me to think about how I can support refugees and asylum seekers here in the UK. It's been an inspiration to see how people have been doing that elsewhere and learning how I can maybe support that where I am at the moment. I really value the stability that CMF brings and that they're with you in all stages of life, from being a medical student to being a junior doctor to working abroad, coming back. CMF are able to support you in all of that. I'm still able to continue my involvement with global mission with CMF by being the global catalyst in the West Midlands. So trying to support and encourage people to consider global mission, to provide opportunities for training and to connect people to others with similar interests to enable them to serve God wherever they are, whether that's locally in cross-cultural mission or abroad. CMF has helped me to put God first and to be willing to take risks for Him and to recognise what's most important, which is living and speaking for Him in all that I do.